Hey everyone, we wanted to talk a quick minute about how to get that perfect film for an x-ray. We know that's kind of an ever elusive thing and it's often hard to get on babies, especially when they're moving around. So we thought we'd give you a couple of good quick tips on how to do that and review those qualities that we're looking for. So for an x-ray, there should always be 3 people involved with the film if possible, if the patient is vented. So that should be the bedside nurse, an airway guardian, who is typically the RT, but if the RT is busy, it can be another nurse looking at that ET tube, and then the x-ray tech who's actually shooting the film. So the airway guardian is solely responsible for that ET tube and making sure that it doesn't move, but the bedside nurse is the one that's really gonna make sure that the position is correct. So once the tech comes into the room, you wanna remove any blankets that the patient may be swaddled in, as well as any baby clothes or anything that have snaps, zippers, because that will all show up on film and distort your view. So you're gonna remove all of that, and if you're getting an abdomen film with your chest, also make sure that you have a dry diaper, because sometimes a wet diaper on film will actually look like neck. So once we get that done, we're gonna get this patient ready to put on our x-ray plate, which the tech will slide underneath your patient. Once they do, things to kind of look for. 1, you want your patient's head to be midline and neutral. And so the best way to figure that out is to draw an imaginary line from the corner of their eye through their ear and straight down to the plate, and that should be perpendicular. If you are chin to chest, where you're more like this, it's actually gonna make your ET tube look too deep on film, and if you are too far extended, it's actually going to pull your ET tube out on film, and so it'll make it look like it's high. So we want to make sure that we're in that good neutral position. In addition to that, you want to make sure that the clavicles and the chest are straight and not rotated, and looking at that with the hips as well. Doing a rotated film where they're kind of off to one side can change what it looks like, and hard to differentiate from your anatomy if there's a disease process going on. We want to make sure that the chest is clear, so any leads, temp probes, anything like that should be either moved off to the side of the patient or taken off altogether. And we don't want those arms overlapping, so kind of have those off to the side. And then last but not least, you want to make sure that that view of your ET tube is visible. So if I was shooting a film right now and my x-ray was going through it, this ET tube would be right over my chest, which would be hard to see. So making sure that it's right off to the side and not covering that chest. And then the very last thing before the tech shoots the film, the airway guardian should look in the mouth and look at the gums to make sure that that ET tube is where it's supposed to be. In this particular case, it's 6 at the gum. And so that's what she should be looking at and letting the x-ray tech know that she is truly at 6 at the gum. That way, if we have to make any adjustments to the x-ray after it's shot, we know exactly where that tube was at the time it was shot. And then we're ready to take the film.